Mind with big plans for his community. Thembekile Mahintsho is a second-year accounting student who's opened a medical store in his community in Milnerton. The residents of Joe Slovo don't have access to over-the-counter meds in their immediate community, and Mahintsho's store is saving them both time and money. The young entrepreneur is doing it all from his own pocket. Thembekile Mahintsho joins us now from our Cape Town studios to talk more about his venture. From one Thembekile to another, good afternoon to you, Thembekile. So it all started, I understand, with a voucher from your NSFAS loan. What drove you to do this?
It is a privilege to be part of this program. My greetings to the viewers. What made me to do this? It was because of the disadvantages of that we are facing in my community. I use those disadvantages to be my advantages, as well as the experience of the loss of my father, who was living in Eastern Cape because of the poor healthcare service that he was receiving. He didn't have access to healthcare products. He had to wait for his payday to go to town and buy the self-medication. So now that made me to be determined in opening a medical store of an over-the-counter. So I decided to uplift my community and to change the community. So let me start where I'm living in Milnerton, Joe Slovo. So it was a calling for me to open a medical store.
So where did you start in getting the necessary medicines? Did you go to town and buy a few of them and then begin to grow it from there?
I used the taxi to go to Epping, where I'm buying my products in Epping, where I buy from Jumbo and also New Look Wholesale. So those are my both suppliers where I buy from, as well as to some of the other pharmacies where I just use a taxi to go to other big pharmacies and buy from them, but bring them to my community and sell them at a lower price. Yeah.
You talk about lower prices, and I'm wondering if you are selling these medicines at such a low price, how is it that you are going to be able to keep the business running?
For me, for now, my aim was not on profit. It was on uplifting my community, because I saw that many people, the majority of people in my community, they struggle to get access to healthcare products. The healthcare products that I'm talking about, it is a Western healthcare products, African traditional products. So now they had to pay a taxi fee to go to town. They had, some of the people, they don't have time to go to town because they are busy. Not everyone has got time. So now I thought of like, my aim was not on the profit. My aim was to uplift the community so that the people can see that I'm bringing change into their life, so that the people can see that I care about the community, so that the people can have hope that that there is a young man that cares about the health of the people in my community. So I wanted to bring that change, but I am making a break even. So my aim was not on profit for now. It was bringing change and uplifting the community. So I'm solving the social issues that we are facing in my community. I'm solving the social issues that we are facing in many communities in Cape Town or all across South Africa.
And I'm sure the community is very grateful and proud of you.
Indeed, yes. The community is very proud of me, because the community is very supportive. Even the school is very supportive. Too many people, they come to me. Some of the people, they come to me. Some of the people, they call me. And I even created a WhatsApp group for my customers, where I communicate with them. They give me advice on what also I can sell, because I'm selling an over-the-counter medication. I'm not a doctor. I'm not selling prescribed medicine, so I'm just selling basic medication. So now the people who are living in my community, they are very, very supportive. Some of them come at night, so my time that I'm closing at 8:30, around 8 o'clock sometimes. Even there at school where I'm studying in CPUT, some of the students that are my classmates, they also support me as well. Or even there at Res where I'm staying, the cleaners who are working for South Point residents, they also support me as well by asking me to bring some medication for them. So I mobilize as well for them.
Tell me then, Thembekile, at the moment you are running as a supermarket or a tuck shop. What is the plan going forward? Do you plan to stay with this going forward, or will you eventually do something else?
My plan for now it was to first grow the business where I'm living, because I first have to create a system. This system it will improve my business to grow, because even if I'm not there at the business, but the business will continue running itself, because I know that if I'm busy with my exams, as I'll be doing a third year next year, and I'm also busy now studying for my exam, if we have already started the writing exam. So now I want to create a backbone of Mangete Medical Store, so that even if I'm not there, even if I'm away from my business, the business will continue running itself. So now the plan is to run other branches all over South Africa, not to just end there in Milnerton, also to go to other areas in Cape Town, go to other areas in Joburg, even go abroad in some of the other countries, in our foreign countries, because the same social health issues that they are facing, they may be similar to the ones that we are facing here in South Africa. So to me, it is about solving the social issues of health and bring access of health products, which are African traditional medication and Western health medication, to the people.
Tell me this then, Thembekile, as we wrap up our chat. You are not doing this for a profit. You're doing this to help your community in Milnerton, Joe Slovo, who are very poor. Have you spoken to the people who you get your stock from, the cash and carries and the wholesalers, about why you're doing this and possibly trying to get cheaper prices for you?
Since I registered my business on the 2nd of June, so now when I went to Jumbo, which is one of my suppliers in Epping, I gave them the name of my business, which is Mangete Medical Store. So now when I go there, it depends on whether I'm buying in bulk, or because when I'm buying in bulk, they give me a discount based on how many products, on how many stock am I buying. But if I buy less products, I don't get any discount. So now there was a pharmacist who was also helping me in buying unscheduled medication. So now she did give me a discount on the products that I was buying from her, but not all of the suppliers are giving me a discount. And I haven't spoken to any, but Jumbo is indeed giving me a discount on when I go there to buy in bulk. Yeah.
Thembekile, let's leave it there for now. It's such a pleasure speaking to you today. That was Thembekile Mahintsho joining us from our Cape Town studio, speaking to us there about a store that he's set up in his community, where he says a lot of the people are impoverished, and what he's doing is selling Schedule A medication.